for a true treatment issue. Yeah.
Thank you. The honourable member for Hanseath.
Thank you, Minister, and thank you for your kind words. I appreciate them, and I know my family would. I guess I'd like a little clarification on when you say a couple of programs that you're looking at. I just wonder if you have any notion of how those are defined, or if you have them defined at this point. In the case of the drugs that I'm referring to, they were bought early in the treatment stage, not at the palliative stage. So they were certainly in the anticipation that they would have a more positive effect. When you say oncology drugs in the community, are you referring to the similar notion to dialysis offered in the community somewhere, where you would get chemo by IV in the community? Is that what I understand you to mean? And I guess that's probably questions enough till I get an explanation of that.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And basically, two programs that we're looking at this point, which of course is the palliative oncology, be able to offer that kind of drug in the community, because a lot of these individuals cannot make it back to hospital, or it's very difficult for them to travel back and forth. The other issue, the other program would be the family pharmacare program itself, which would cover oncology drugs if they get into a situation like that as well.
Thank you. The honourable member for Hanseath.
Thank you, Mr. Chair, and thanks to the Minister. I guess if you're looking at a program through pharmacare, have you got a price tag on that? Do you have any notion of what people will spend generally out of their pocket in the province? I know it's not a static number, but because from year to year it would vary. But I just wonder if you have any notion of roughly what the cost of that would be.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And from what we understand at this point, we're not too sure of how much drugs are being bought outside the hospital system, just for the virtue of many of these individuals would have private insurance and are booking it that way. There was a pilot project, I believe, in the northern region, which was looking at trying to find ways to cover these individuals, so they might have an idea what those numbers are, and what I can do is try to get some of those numbers together for you to have available.
Thank you. The honourable member from Hanseath.
Thank you, Mr. Chair, and thanks to the Minister. I remember the debate around OxyContin in Cape Breton, and one of the issues was around a system of tracking, so that someone couldn't go and get a prescription. Somehow it would come up online that you would know that they already had gotten a prescription somewhere else, so I'm thinking, I guess my question would be, if you have a system like that in place, or whether you have a system like that in place, so that you actually would have data to know what physicians are prescribing, and therefore would have that kind of information at hand. Is there a system in place like that?
Thank you. The Honourable the Minister of Health.
There's basically two programs that we're looking at this point. There's of course the prescription monitoring program, which would look at mostly painkiller, pain management type drugs like the OxyContins, even Tylenol 3 would be covered under the prescription monitoring program. So we do have an idea of what kind of prescription levels and amounts and those kinds of things would be available for that kind of drug. We still don't have necessarily an idea of the oncology type drugs that are administered orally. We can go and probably get that information pretty quickly, but just we don't have that available in our documents right now.
Thank you. The Honourable member for Hanseath.
I want to say thank you. I'd be interested to know as time moves on where you are with that and what kind of numbers you get. But it is one that I want to encourage. I want to encourage the government on, and I think there are people who would, well, obviously there are people who would benefit from that, and I just see, you know, two different worlds where people are paying and people are not. Doesn't strike me as being fair. Just a couple of things around issues in Hants East, the resource center. I know the Capital District does the analysis on dialysis as to you know, where that service should go. So I want to put a plug in for the resource center in Elmsdale. I got to say that you know, we have 10,000 people in the corridor, you know, from Enfield to Shubenacadie, 9 Mile River. If I was to look at the dollars spent in my constituency, say compared to Tatmagoush area, you know, which is in the same DHA, that you know, the populations, you know, are not comparable. You know, certainly the northern region there doesn't have a similar population, but you know, I don't begrudge them getting services and getting money from my DHA. I think that's, if they can, that's a good thing. But it seems to be extremely disproportionate for the number of people in the area compared to my area. And so I certainly think I should be a voice for them. But dialysis and X-ray are two services that the people on my community health board would like to see in the resource center. And there may be a couple others, but definitely those two are the two that keep coming to me. So I'm not sure what your role is well, I guess I found not much in terms of directing the DHA, but I'd like to know, I guess, around the analysis of dialysis in the Capital District, how they determine where dialysis will go and where it won't go, and if you have any comments around X-ray, that would be fine, and after that I'll hand off to my colleagues.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And we'll basically look at two different things when it comes to the Hants East Clinic. Dialysis, of course, number one. Dialysis has been a bit of a challenge to make sure that you have the most appropriate service in the right place. You know, trying to project forward of the amount of diabetes versus the amount of renal disease. You know, we do have basically 3 programs in the province. Of course, the main program here, administered by Capital Health, which does have remote clinics in places like Antigonish, of course down in South Shore at Liverpool. Yarmouth has its own program, and Cape Breton has its own program. So we need to better appreciate maybe what a smaller unit might be able to bring us if there's a way to administer that kind of service in a smaller way. The guidelines that go with dialysis, you know, a good clean water source, good sewage so that the water can be treated correctly, the availability of the correct type of nursing care available at that place. So, you know, it's not necessarily difficult when you have sort of those 3 things, but we just need to make sure the demand would keep up with it. And we do have some other outlying areas that are underserved as well that we need to seriously look at as well. You know, places like in Richmond County, you know, we got people driving basically from Arishat to Sydney, and that doesn't seem right to me either. So we need to find, you know, a little more economical way to do it. There is a couple of course, Antigonish, of course, the comment that my deputy minister is writing to me is that Antigonish is a full program, really. It was a pilot to test the placing of services in another location and doing it in a different way, and basically having the staff in Halifax oversee it, or, you know, provide that kind of oversight for it rather than having them on site. And I think it's working very well, and I think you could probably ask the member for Antigonish for how well that program has worked for his area, and of course all the surrounding areas too. So it's definitely in consideration. What I can probably do as well, there's a really good presentation that the dialysis group has done, looking at the projections in the areas for people, and I wouldn't mind sharing that with you as well. When it comes to Hants East and other services, you know, the growing area, you know, you look at the growing populations close to HRM, of course, the Sackville in those areas, and of course going up to Hants, and there's a little bit South Shore, but not quite as much. There has been an appreciation for that this year. In this year's budget, there's about $500,000 of operating dollars going directly to the operation of the Hants East Clinic.
Thank you. The honourable member from Hants East.
Thank you, Mr. Minister, and I'll hand over to my colleague from Shelburne. Thanks a lot.
Thank you. The chair now recognizes the honourable member from Shelburne.
Thank you very much, Mr. Chair. I take the privilege of having the opportunity to ask the minister this particular question. And Mr. Chair, through you to the minister, my first question in the House after being elected in 2006 was the question on the construction or the expansion of Bayside Home, and I see the minister nodding. And I think I just want to refresh the minister's memory that I tabled a design of a blueprint of a building that was scheduled to be built some 30 years ago, and that's growing as we speak. So we know that the plan was in place some 30 years ago, and the people of southwest Nova Scotia or western Shelburne County have been patiently waiting for this to be completed. And also in 2007, I'll read a portion, Mr. Chair, from a press release that I issued. And in 2007, I issued this particular press release. I'll read a portion of it. Residents got the impression by the minister that Bayside was different and could happen faster because it was approved ahead of the current process to be built new nursing homes. Early this year, the minister was interviewed on a radio calling show in southwest part of the province, and he stated the people of Barrington could expect to see the earth move on Brass Hill in the fall of 2007. Well, Mr. Chair, through you, the earth has not moved, and I know that the members I've observed in the last week since this House has been in session that the government has very frequently tabled a number of pictures. And Mr. Chair, I'd love to table a picture of Bayside Home, which I took the pleasure of myself over the weekend. And I can assure the minister, if he looks at this particular picture, that the earth still has not moved. And my question, Mr. Chair, through you, can the minister give us an update, and can he clarify or just recognize the statement of 2007, and can he recognize the picture of this particular weekend and an update on Bayside Home? Thank you.
Thank you. The chair now recognizes the Minister of Health.
Thank you very much, Mr. Chair, and I would love nothing more than to be able to present a picture of Bayside Homes. Unfortunately, I cannot to show you the construction at that facility at this point, but I will give you an update on where it is in process at this particular time. Of course, just to sort of inform the rest of the House today, basically Bayside was an expansion of an existing residential care facility, which would see the addition of 30 nursing home beds and 10 residential care facilities for a total of 40 beds. The occupancy date is still January 2010, as it always has been. The status of it at this point is a Y, which means a risk of having a material change to scope, budget, or timeline, or a little bit at risk, which means the response sent on Step 3 functional program, continue to work on the schematic designs at this point. The geotechnical survey has been completed and sent to the design team. So here's the issues and the risk when it comes to the construction addition of Bayside is the facility needs to reduce initial capital budget. The first budget came in way above our expectations for that facility, so they've gone back for some further discussions to bring that number down to somewhere that is more on the average of the rest of the replacements and or new constructions in the province. They do require a final approval on that staffing. When it comes to the staffing budget, the number of people that will be serving the residents at Bayside, and their final approval for the operational budget is still in discussion with the group. So there's still a fair amount of discussion going on right now in order to give the final go-ahead. But the occupancy itself has not changed, which is January of 2010.
Thank you. The honourable member for Shelburne.
Thank you very much, Mr. Chair. At this time, I'd like to thank the Minister for his response, and I'll give my time over to the member from Pictou East.
Okay. Thank you. The honourable member from Pictou East.
Well, thank you very much. I am very, very pleased to have this opportunity to put a question or two to the minister. I hope to have some time a little later on, a little more time. I think I'm probably close to being a filler here. Our time is running out. But the number one concern, I want to address a couple of regional concerns. And certainly the number one concern in Pictou County is the closure of the intensive care unit there. And when there is a closure like that, the concerns are many and they are very justified. Now, I know that in the short term, we are looking at some solutions and things are looking a little better there. And so having said that, it's the long term that I'm addressing here at the moment. And I'd like to ask the minister, in relationship to the new residencies announced in the budget, is there any way that we can look at those with a health authority being able to designate the subspecialty or whatever that those positions could, in fact, in the Aberdeen's case, internal medicine is very important. And we don't know how many of those new residencies will result in internal medicine. So the question then is there any way that a health authority has some kind of say in the direction of a residency?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I wish all questions would be that easy, and it's yes. Basically what happens is there's a bit of a survey that goes on from the department in Halifax out to the district health authorities, asking them what their requirements are. We of course always know what open positions are available in each district, and we would through negotiations direct Dal on what kind of positions we need. The unfortunate part that we've had in the last couple of years is that there's only been the availability of one internal medicine specialist at Dalhousie, and that concerns me that we do need to have probably 3 more in my mind, so for a total of 4 for training across this province. I do want to tell the member opposite some very, very good news that I learned, of course, on the way in from my meeting in Yarmouth, is that we're going to be opening the ICU a week earlier than we had originally anticipated. It'll be opening on May 8th. There is a long-term locum program in place, which is something sooner. I believe there's almost 3 physicians which will be participating in that locum program. So May 8th, so it'll be actually a full week earlier than we had originally anticipated. And apparently the original mid-month date wasn't firm, but that was what they were hoping for. So I can confirm to the House today, May 8th, it'll be opening on a long-term locum program.
Thank you. The honourable member from Pictou East.
Thank you very much, Mr. Minister. Certainly the member for Pictou West and I were aware of that, but we, of course, weren't going to make the announcement. It was up to you to do that. So thank you very much. We are happy that Pat Lee and others at that hospital are doing an exceptional job in trying to address the problems that are there. I have a concern about the sustainability of the orthopedic program at the Aberdeen. And there is a concern in the community about that. So my question is that concern justified, and is there adequate funding for the orthopedic program at the Aberdeen?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I can assure the member from Pictou East that the dollars are there available to that program to to continue. The challenge that we've been having at that site, of course, has been the lack of staying power for the orthopedic surgeons that are there. We are a tad short, I believe, on complement there. And I know the district is doing its best to try to recruit for that program, and I'm sure, you know, knowing their successes in the past, that it will be successful in recruiting another orthopedic surgeon there.
Thank you. The honourable member from Pictou East has approximately 2 minutes left.
One additional question. I have a couple of others, but I probably have time to get one additional question in. 2 years ago, there were between 16 and 18 seniors in the Aberdeen Hospital awaiting long-term care facility. Right now, as of this morning, we are looking at 28. The number peaked a couple of weeks ago at 32. 30% of the beds at the Aberdeen Hospital are being taken up by seniors, and that's through no fault of their own, certainly. My fundamental concern is that we are dealing with 89 units at the Shire Town, which are going to be replaced with 89 units in 2 facilities for a net gain of 0. And I believe that that is fundamentally wrong. We need more units in Pictou County. And the population is aging. Some of the patients that are in the Aberdeen Hospital awaiting the long-term care facilities are in fact people who have been there for 8 months or more. And in one case, we're dealing with a person who has been there for 2 years. Now that is a special circumstance, and that person actually needs security at the door of that unit. And I feel that this is fundamentally wrong to replace 89 units.
Order, please. Order, please. The honourable member's time has expired. The chair now recognizes the honourable member from Glace Bay.
Thank you, Mr. Chair. Good afternoon, Minister and staff. And I will just sort of forewarn you right now that I'll be jumping all over the place. I don't mean to have you leafing through your booklets, but that's just the way it's going to go. Let me, everything from wait times to midwifery to long-term care. We're going to bounce around for the next hour. Let me start by asking this then, Mr. Minister, Mr. Chair, concerning the issue of midwifery regulation, the Midwifery Regulation Council specifically. And I note in the budget address there is $200,000 set aside for that council. And I was wondering whether the minister could please confirm as to whether or not that expenditure is included under primary care initiatives in page 14.7 of the supplementary detail.
Thank you. The Honourable the Minister of Health.
Thank you very much. As Alan searches for that, you know, I will take on the member for Pictou West, East, sorry, on his comments for the area. Of course, throughout the province, there are a number of individuals, of course, staying in the homes close to Pictou, close to New Glasgow, who deserve to be in places closer to their homes, which are Truro, Colchester, Amherst areas in Cumberland, etc. And once those homes are built by 2010, those individuals will be moving off and opening up a fair amount of beds in the Pictou area. So, you know, there is a balancing effect in the first round of beds. The issue of midwifery, and I thank the member opposite for his question, is one that we're getting dollars ready to basically start. I believe it's 3 pilots across the province in order to hire full-time the approximately 6 midwives, trained midwives that we have in the province. I know Alan's still searching away here to find out where the dollar amounts are put. Okay, we know the hiring is under primary health care. So we'll just dig a little further to see exactly where they fit in the budget. But again, we'll be hiring as a pilot the six midwives to basically work within those districts to make them aware of what a midwife is, how that person would integrate into the healthcare system, especially when it comes to child and mother care, when it comes to pregnancy.
Thank you. Young member from Glace Bay.
I'm not sure, Mr. Minister, Mr. Chair, but I think the minister is saying you're going to answer that at another time. Okay. While you continue to dig, then let me give you an indication what I'm looking for. I'm looking for you to elaborate whether those funds are going to be used for actually the transition of midwives into the healthcare system, or is that money going to be used solely to establish the regulation council for midwives in the province?
Thank you. The Honourable Minister of Health.
Thank you very much. Basically, there's two amounts in here somewheres. The $200,000 is to help establish the College of Midwives, which will oversee the regulation and the disciplinary issues when it pertains to midwives. There are some extra dollars in there, and I believe they would be fitting under the districts and primary health care on the hiring of those individuals into the health system in those areas.
Thank you. The Honourable member for Glace Bay.
Thank you, Mr. Chair. I'm looking for, Mr. Minister, then, is how much, if that $200,000 is going only for the council, how much money has been set aside to introduce midwives into our healthcare system? You said the 6 midwives. How much is that going to cost to introduce those 6 midwives into the healthcare system?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And as I said, we'll be setting up 3 pilot projects. The districts are bidding on those 3 pilot projects. We figure it'll be another extra $500,000 or $500,000 in order to integrate those midwives as they stand into the system today.
Thank you. The Honourable member from Glace Bay.
Thank you, Mr. Chair. That $500,000 then that will be used specifically and only once for the introduction of those 6 midwives. Does that mean that we will see midwives practicing in this province this year?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And if everything goes the way it's supposed to go, and when it comes to the final approval of those regulations, the final proclamation of the Act, we think that's happening in end of November, December. At that point, there should be 6 midwives working full-time in the system in Nova Scotia.
Thank you. The Honourable member from Glace Bay.
Thank you, Mr. Chair. This is May. Could I ask the minister why it's going to take until the end of the year to make that a realization?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. Of course, through the advisory committee, which is, of course, the setup committee for the college, which, of course, is made up of a number of different professionals, including midwives, want to make sure that the regulations are complete. We don't foresee the regulations, and this is between the college lawyer and, of course, our lawyers, to make sure that all the regulations are in place so that when the midwives start, they will be covered by those new regulations and by the Act. We feel, and I'm being, maybe giving too much time to this, but we don't think that's going to be available until December.
Thank you. The Honourable member from Glace Bay.
Thank you, Mr. Chair. Let me change the topic a bit. Then again, on page 14.7 of the supplementary estimates, I note that there is no money that's set aside this year for pandemic planning. And I'm wondering, has that money been rolled into another budget item?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And the dollars would basically be in administration. Of course, as I probably said, I don't believe if it was on Thursday, on Friday, we talked about the new emergency planning unit that we've set up in conjunction with the Department of Health, Department of HPP, and Department of Community Services, which is being headed up by retired Commander Russell Stewart. And I believe those dollars, like I said, those dollars are under our administration headlines.
Thank you. The honourable member from Glace Bay.
Thank you, Mr. Chair. Mr. Minister, how much has actually been set aside in total for pandemic planning? And if let me give you a couple of questions here. If whatever that amount is, how much? If you're indicating that you're allocating money for pandemic planning to district health authorities, then how much for each district health authority, and whether or not, if that money is going to the DHAs, is that money portable? In other words, can that money be used for other things other than pandemic planning?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And simply put, there's a couple of places you would find pandemic planning. One, of course, through HPP in the vaccine side of pandemic planning. Of course, the rest of it would be well, three places. So one place under the emergency planning unit through community services and health, and the districts themselves through their business plans have dollars attached to it. And I don't have those dollars available to me right now, but I could have them available to us in the next number of days.
Thank you. The Honourable member for Glace Bay.
Okay, thank you, Mr. Minister. That would be much appreciated. I would hope anyway that there would be a fair amount that's allocated for this, given what happened with the outbreak of mumps in the province and so on. We know that we have to be a little bit better prepared, and in order to do that, of course, you have to provide the funding that should be there. Let me switch to another topic of wait times, Mr. Minister. According to the budget speech, there was mention of a chief executive of wait times improvement. How much is going to be spent on that position?
The Honourable the Minister of Health.
Thank you very much. Of course, our Executive Director, Wait Times Improvement, there is so much going on in that realm, and of course the importance that this government has put upon it. It's basically a contract with an individual for $120,000 plus benefits, plus, of course, office space and all those things that would go along with it within the department. So those are the dollars that are attached to it at this point.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. Let me specifically with that position. Number one, where do you find where is it in the budget? Where is that money in the budget for that position? And let me add a few more questions. Has that person been hired? How long is the contract? What were the qualifications for that person? And what exactly is it that person is expected to do?
Thank you. The Honourable Minister of Health.
What was her name? Thank you very much, Mr. Chair, and I apologize for taking a little time to make sure I get all my facts straight here. This is a 5-year contract. This individual comes with a nursing background. She was also a VP of an international consulting company. The individual's name is Nancy McLeod, and I believe she has started in the department within the last number of weeks in order to try to organize the whole issue of wait times in the province.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, one could, I guess, if one looked at it a particular way, spending that much money on an administrative position to try and improve wait times might lead one to ask some of the following questions. Number one, how can we be assured that that position, that person is actually going to do something to improve wait times in this province? And I'm left to kind of wonder whether it wouldn't be more efficient to work with the physicians and specialists and other healthcare providers to ensure that improvements are there in wait times, rather than simply adding what is going to turn out to be another very expensive administrative position.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. As the member opposite is aware, we've been spending a lot of time, and there are a number of dollars allocated, some federal dollars allocated to wait time improvement in this province. There is a lot of complexities when it comes to wait times, and therefore requires the dedication of an individual and of a project office. Mr. Chair, I can say that my Deputy Minister, the Executive Director of Acute and Tertiary Care, my CFO are incredibly able and talented individuals, but they cannot organize the whole wait times issue because of the complexity within it. And I think the dedication of an individual that can work across the system, work with physicians, work with district health authorities, work with everything that's involved in order to make a wait time better, I think is very important to have a true leader in that capacity.
Thank you. The Honourable Member from Glace Bay.
Thank you, Mr. Chair. To a certain extent, I agree with the Minister, and I understand where he and his staff are coming from, but to the ordinary Nova Scotian who's out there and walking into an emergency department and waiting or whatever, if I were to tell them that we've just hired another administrative person to be the chief executive of wait times improvement, and we're paying them $120,000 a year, wait times are going to get better. Don't you worry about it. I would think that probably I wouldn't be able to convince them that that's going to do anything to really improve wait times. It has nothing to do with the individual that you've hired or her qualifications or anything else. It's just that it would appear on the surface anyway that another administrative position is going to be the the be-all and end-all of curing wait times in this province, and we've learned in the past that that is not the case. I do have a lot more questions for the Minister, but I did want to accommodate my colleague from Preston who has some more questions that he would like to get in at this time. So if I may, Mr. Chair, turn it over for the next whatever amount of time to my colleague from Preston.
Thank you. The Chair now recognizes the Honourable Member for Preston.
Thank you very much, and I thank my colleague from Glace Bay for allowing me this time. It's very appropriate you're talking about administrative staff for wait times. Just so happened I had a lady in my office this morning that has been waiting for an operation at the Dixon Center for a year. She's number 7 on the list, has been number 7 on the list for a year, and a specialist told her that they cut back the operating time in the operating rooms and actually to come forward and see her MLA and see if anything can be done. Now, this particular lady is a 25-year survivor of cancer, and she has called the specialist. She's asked for a cancellation, anything she can possibly do to get this done. Now, the growth she has is growing. They figure it's going to turn cancerous, and this sort of wait time just isn't acceptable. So it'd be interesting to see, like my colleague says here, putting more money into administration. Maybe we should put some more money in the operating rooms and see if we can't get these open longer and get this forward.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, before I go to answer that issue, I know the member opposite had been talking about the cleanliness in hospitals, and I just wanted to table some information on the training that goes into the cleaners in in each department in the hospital, and talks about how they clean, the frequencies and days per week, et cetera. So I just want to table that, maybe get a copy for the member for Preston. When it comes to operating rooms, and this has happened within the last year, we were running in Capital District at approximately 20 operating rooms working on a full-time basis. There were approximately 12 that were not being utilized because of the lack of anesthesiology. Due to the hard work of people like Yap Bonnier, Dr. Mike Murphy, we are at full complement when it comes to anesthesia. We are utilizing all operating rooms in the district, which I believe is 32 on a full-time basis. So I know that through the district that they are catching up on an awful lot of that backlog, and hopefully the members' constituent will be seen in a timely manner.
Thank you. The honourable member for Preston.
According to my constituent today, and she's not an individual that comes forward and complains about everything. It's the first time I've actually ever met her in my office. She's very upset. You can imagine anyone that's gone through cancer once and survived has a different perspective on life and what it means if you don't get timely medical care. She went through the whole process, seen her family doctor, the specialist, everything's all set to go. There's no operating room time. And from what the doctor's been saying is it may be several months before it can be operated on. And the growth is now becoming very obvious, and it's becoming a very difficult thing. And how many more people are in this situation? I mean, this is a very, very serious situation. I mean, it's one thing if you're going to get a knee replaced or a hip replaced, you can live with that, even though it's very painful. You can live with that. But if you're talking with someone that has had cancer in the past, possibly this will turn into cancer again, how can you explain to somebody like that indeed they can't get the treatment they need when they need the treatment?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And I'm just conversing a little bit with my deputy about this one. As far as we understand and working with our oncologists, that we are within national standards. This one seems way off the national standard on wait times when it comes to some kind of oncological type of operation. I would ask that maybe if the member could provide me with some information on that I can go maybe look at a little closer on that. There might be some situation or circumstance that what that constituent needs is special. I don't know. It is not the norm that I've been hearing from the department when we track this information. So if the member could provide me with some of that information, I'd appreciate that.
Thank you. The honourable member from Preston.
Yes, I would be pleased to do that out of this environment, of course, because I don't want to identify the individual that we're talking about, as I know you do not want to. I want to thank you for the information on this cleanliness housekeeping service. It's interesting information, but in some hospitals I would suggest this is not happening. And I would like to know, since I asked you the questions on Friday, if the department has had an opportunity to further inspect some of the hospitals. This is a very timely thing, and if there's been anything done or staff has had any opportunity to indeed look at this and see what can be done to resolve this problem.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And I know over the last couple of days, as we've been in estimates discussing our budget, there has been a number of phone calls gone to the CEOs of each district, so they're very well aware of the discussion. And I would hope that they're following up with some of the issues as the issue the member brought up on Friday, I believe. You know, and I also had the opportunity to check out again my hospital in Yarmouth. Of course, we had a quick meeting with them this morning, talking about some of our broader transformative change issues. But I was also there for an EKG, and because the member brought it up on Friday, I was sort of snooping around, looking around as well. So I know that our hospital is very well served, Mr. Chair. But I know that the comments have been shared with the CEOs for them to follow up on.
Thank you. The honourable member from Preston.
Thank you. What exact plans does the minister have, or the deputy minister have, or the senior officials of the department to ensure that this is being done? It's fine to say that you know, it's been followed up, and I do appreciate that effort, and I know you take this very seriously. What exact plans are going to be in place to ensure this happens and continues to happen properly, and indeed that when the patient goes in there, that the place is clean and properly cleaned, And again, I stress, as I stressed on Friday, I don't believe it's the staff that's a problem here. It's the resources and the ability to get in the rooms to do the work. So if people can't get in there to do the work because they're overcrowded or whatever the case may be, which appears to be with the wait times and everything, they're scrambling to trying to get everyone looked after, what exact action plan do you have to make sure this is going to happen?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. Again, two things are happening in that respect. Of course, it is, again, sharing that information with our CEOs to follow up and come back with a report to us on how their cleanliness is, maybe. The other issue is providing it for checking from the Infection Control Committee. The Infection Control Committee in each district will be following up on the cleanliness of those hospitals. And also the accreditation of a hospital depends on a lot of factors, including cleanliness, so we'll go and check up on that issue as well. So there are three veins that we can go at this one on. And I can assure the member opposite that we will be addressing this one as quickly as we can. The issue of having people in, I mean, we have a 2-person ward, we have a 3-person ward in most of our hospitals. A lot of them in the newer hospitals, of course, are single rooms. And I know there are mechanisms in which to clean rooms even when there's a person in them. There's even ways to, of course, change linens while a person is in them. I've actually seen it done, and it's quite a task, but definitely something that is very needed in some cases, depending on how long an individual is laying in bed. But anyway, Mr. Chair, we will be taking that on very aggressively.
Thank you. The Honourable Member for Preston.
Thank you very much, Mr. Chair. I'm going to turn my time back over to the Honourable Member from Glace Bay.
Thank you. The Chair now recognizes the Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, on page 24 of the budget speech, it indicates that your government is well underway to meeting the goal of a wait time guarantee of 8 weeks for patients needing radiation therapy with the help of Health Canada's $33 million. Could the Minister then indicate whether that $33 million is for this year alone, whether it's spread over a number of years? If this money is spread over a number of years, then which fiscal years and how much for each year?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And again, I was very happy to be happy to be a part of the first province to sign on to a radiation or to a wait time guarantee with the federal government. Just to give you an idea where the $32 million is going, basically $24 million goes to equipment and upgrading of the 2 existing oncology sites. Basically, when it comes to the construction of bunker design, the bunkers, the LINACs or the linear accelerators, the CT simulators, which is for Cape Breton, which I think is a cost over the next, 708, there was a, okay, and I'll list it off here. Over 708, 156,000 was spent. 0809, there'll be $1.9 million spent, and then 0910, there'll be $2.2 million spent, for a total of $4,256,267 for the site in Cape Breton. In Halifax, there will be, okay, bunkers, we'll do this at bunkers, the CT simulator, the TOMOs, I have no idea what a TOMO is, 2 LINACs and other costs bring us to a cost of $16,453,014. This year is the first year that we'll be spending dollars on that, which is $4 million or $4.2 million this year and $12.2 million next year. What we're also seeing is that $8 million, of course, were 2 pilot projects, not particularly attached to the issue of oncology. One was $4 million for orthopedics, and the other was $4 million for radiology.
Thank you. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. I'm wondering if the Minister could indicate what the current wait time for radiation therapy is in this province.
Thank you. The Honourable Minister of Health.
Thank you very much. Yeah, no, I don't have the particular number with me today, what today's wait time is. We know that we're within days of that guarantee, but we know that over the next 3 years, the incidence of cancer will increase. So therefore, we need to meet the increase of not the list of today, but we need to meet the increase of 2010. So we know we're pretty close to that 6 week or that 8 weeks right now, and you know, even with the extra added on, we will still maintain that 6 weeks.
Thank you. The honourable member for Glace Bay.
Mr. Chair, the budget speech went on to mention that there's a pilot project underway for diagnostic imaging. Could the minister elaborate on that pilot project? Where is it, and how much is being spent, and how long that pilot has been underway?
Thank you. The Minister of Health.
Thank you very much, Mr. Chair. There are two projects in that. Again, there are $4 million for diagnostic imaging and $4 million for orthopedics. The diagnostic imaging is basically pertaining to a computerized program that primary physicians would be using to order radiological tests, basically inputting information on the patient, and the program would kick out the type of test that individual should be taking. So whether it be the difference between taking an simple X-ray versus a more expensive MRI. So being more appropriate in the tests that are actually happening. And it is a program and a system that is approved by the Canadian Radiological Society. Basically put, I'm just trying to look at the cash flow here. This year there'll be $465,000 spent. Oh no, this year there was $465,000 spent. There will be $1.57 million spent next year, so that's 08-09, and 09-10 there'll be another $1.4 million spent for a total of $3.4 million there.
Thank you. The honourable member for Glace Bay.
Mr. Chair, I note on page 14.17 under capital grants that the monies allocated for diagnostic and medical equipment have decreased by $12 million, estimate over estimate, and by $4 million, the estimate over last year's forecast. So I'm wondering if the minister could please explain that reduction.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. That is the leftover money from the FME, or the Federal Medical Equipment Fund. It is dollars that are fully committed, but the districts and the system has not been able to purchase or get that equipment on site. So that's representative of the dollars that had come, I think, last 5 years ago, 3 years ago, from the federal government.
Thank you. The honourable member for Glace Bay.
Yeah, it's like a trust fund.
It's the minister say it was like a trust fund? Okay. If the minister has any idea, I'm wondering if of capital requests that are there from the district health authorities for diagnostic and medical equipment, and how does the budget align with those requests from the DHAs?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. We went out to the districts to find out the age and the quality of the equipment that they have. We know there are some gaps. A lot of districts are making do with the equipment that they have. To be quite candid with the member opposite, the dollars in this budget are low when it comes to equipment replacement in the districts.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. If the minister is admitting that the dollars are, as he put it, low, that there's an actual reduction in the amount of dollars that are that's being spent on diagnostic and medical equipment, and if that's the case, if the actual dollars are less, if the amount is low, then how, in the name of heaven, would you expect to reduce wait times if you're reducing the budget on diagnostic and medical equipment? How could you possibly accomplish any type of goal that you would set to reduce wait times in this province?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And the deputy is saying to me that a majority of the really heavy capital equipment has been replaced over the last number of years. So that leaves a lot of course, the smaller stuff, but they do need to be replaced. But the MRIs and the CTs have all been replaced in this province. Basically, to the member opposite, I am given a grant of a certain tens of millions of dollars. In this case, this year, it's $51.7 million, which takes in all capital requirements for the province. This year, we had to contend with some rising costs for construction, which included the extra dollars that we had to put into the Colchester Regional Hospital, some of the extra dollars that we have to put into the emergency room here at the infirmary site, and the rest of the construction is going on. Some of that construction and renovation does include replacement of equipment, but they are held within the design and the plans for those areas.
Thank you. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. I want to stay on that topic just for a minute, because I asked the minister specifically for his opinion how you would expect to reduce wait times in this province. If you're talking about some diagnostic equipment, whether it be the big stuff or the little stuff, it all fits into the area of diagnosing illness. And if it's not there, if it hasn't been replaced, and even if you are using some of that money that's there for capital projects and so on, you can have the bricks and mortar. If you don't have something inside of it, then there's not much sense in having the bricks and mortar, and you need that equipment. So again, to be realistic, and that's what I'm looking for from the minister, is a realistic attitude or a realistic forecast of how much we can expect to see wait times actually reduced in this province. And if you're dealing with a problem of a budgetary problem for wait times for diagnostic equipment and medical equipment, then big or little equipment, that's going to affect the actual effect that you can have on the reduction of wait times. So realistically is what I'm looking for. Realistically, and I whether it's a short answer or a long answer, a realistic answer of how much the minister expects his department's going to be able to do, for instance, this year, for the rest of this year, in actually reducing wait times in this province.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I'm trying to be as realistic as I possibly can be and as candid as I can be, Mr. Chair, when it comes to wait times. Wait times is a very important issue for me. I do not want to see people waiting longer than in any acceptable norm. We know immediate it cannot happen, but within accepted norms, within reasonable times, people should be getting their treatments as soon as possible. Mr. Chair, I can say that under the $290.8 million worth of projects ongoing in this province today, which includes bricks and mortar, which includes new equipment, I can say that with the dollars that are expended to the district health authorities, which do have line items on some of the smaller equipment, that we will be well served this year in replacing equipment, making sure that also that should a major piece of equipment go down, that we will be replacing it. So there are dollars and pieces of money within our budget that is going towards equipment replacement. And like I said, if anything major happens, we are going to be covering those costs as well.
Thank you. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. I realize, I really do, that the minister is trying to be as candid as he possibly can. And I realize the difficulty of the situation and the enormity of the situation as well. I realize that. But again, when we get to the basics of it all, and I'm sure the minister, as any other MLA in this chamber, is quite used to hearing complaints about waiting for various aspects of health care in this province. And when we talk about realistic goals, when we talk about, for instance, the minister has set a realistic goal that we should have a wait time guarantee of 8 weeks for patients who are needing radiation therapy in this province. But we also know at the same time that if you're looking for such things as there are some orthopedic surgeries, for instance, that would be are requiring wait times that are not in the number of weeks anymore. They're over a year, whatever the case may be. And we know that the minister has made some attempts to reduce wait times in some areas, because we've recently had the introduction of the use of surgical suites at Scotia Surgery. So again, to be realistic and to set those goals, I'm wondering if the minister has those plans. What are his goals specifically in this province to reduce whatever the area may be of wait times? And again, that area, I know that area is huge, it's big when we talk about wait times, but to the average Nova Scotian, wait time can be whether or not they're waiting to get their hip replaced, how long they waited in an emergency room, or how long they've waited to get a doctor in their area. I don't know if that's a category, but I would place that in that category as well. So what I guess I'm looking for is the minister to give us some, not that he hasn't been candid and has been realistic, but to give us an overall picture of where he hopes in the next year, the next 2 years, the next 5 years, that this province is going to be in terms of wait times, and how can we really take a good kick at those wait times that are out there and knock some of them down to a reasonable level, ideally to get rid of them so that we would no longer have wait times in this province. That would be the ideal situation. But to realistically take a look at it and say, where are we going to be in 5 years from now? Are we still going to be waiting a year and a half for some orthopedic surgery? What sort of wait times are we going to have? So, and I invite the minister in this case, again, to be candid, but at the same time, let's hear those plans that you have, Mr. Minister, to reduce wait times in Nova Scotia.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I appreciate the members' interest in this aspect of healthcare. Wait times has been extremely complicated because you don't want to focus in one area at the expense of another area. So you have to do these things in a very coordinated fashion, which is why I think it's very important to have one person that's organizing this, not 10. I mean, really in the department, right now we have probably, I can count 6 people that are dealing with wait times in the province, all on their extra time over and above the existing job. So by coordinating this, I think is going to make a big difference on us understanding where some of those bottlenecks are. To the member opposite, personally, this is where I think we're going to be focusing our time. This is where I want to be focusing our time. Number one is orthopedics. Trying to find mechanisms in which to see individuals quicker. And I think with the dollars available to us from the federal government, which is $4 million on the orthopedics website, the orthopedics patient portal will make a difference for patients, so they're more informed about their wait time. The addition of an assessment clinic, I believe, will make a humongous change to the wait times in this province. As I said before in this House, we have been approached by a group basically out of Calgary, which set up an assessment clinic in Calgary a couple of years ago. And basically all orthopedic referrals go through that assessment clinic and are triaged accordingly, whether you need physiotherapy, at the early stages of some kind of orthopedic issue, whether you need major surgery or minor surgery, would be referred off to it. What they found in Alberta is over half, somewhere close to half, of the people that were on this fictitious, unknown wait list, because right now there are probably 5 different orthopedic wait lists in this province. There becomes one. About half of those patients did not need surgical intervention. They needed extra, some pharmaceuticals, they needed some physiotherapy, etc. So I think by focusing on an assessment clinic and by merging those 5 or 6 wait lists into one, I think we can make decisions more quickly. So that's where my plan is for orthopedics, and also utilizing the surgery, the ORs as we have them today, again through the dedication of the individuals at Capital Health of opening all those surgical suites. And also the usage of Scotia Surgery for some of those minor procedures. You know, what we're seeing, if we can take 500 of those smaller procedures, those knee scopes, those little day surgeries, you know, there's 500 or at least 500 persons worth of more work that can happen during the allotted times in the bigger OR suites here at Capital. So I couldn't wager what a guess would be in what kind of change it would mean to a constituent of mine or a constituent of the member for Glace Bay, but I know there will be some substantial changes beginning this year and hopefully getting better over the next couple. I mean, if you take a wait list, I think they were saying somewhere where 4,000 people sitting on the wait list here at Capital. So that's just this service. And if you can take 2,000 people out of that list and serve them more correctly and more appropriately without surgical intervention, I think we're going to go a long ways. The other place where I want to see some focus happen is, of course, our ERs. The waits that people are having at ERs, I know, Mr. Chair, you've heard it quite often for the hospital in Yarmouth, and I do normally use Yarmouth for a good example for things, but in this case I'm going to use it as a bad example. You know, waits a lot of times, if somebody's sitting in the ER waiting for whatever it may be, you know, if they're waiting more than a couple hours, you know, I don't think it's right. I do hear of constituents that are waiting 8 hours, 10 hours, or more in some cases to be seen for, you know, minor issues, colds, flus, prescription renewals, and those kinds of things. And what we need to do is go back to our basics. As I said before, I mean, a lot of these emergency rooms began as outpatients. I mean, outpatients were designed to treat the population of people that didn't have a physician, didn't have time to go to their physician, or what have you, and could be seen in a more structured fashion. And you had another smaller group of people that needed the ER, so the ones and twos, if I can use the listing. I forget what the listing's called, but no, the listing of the triage list. Okay. Yeah, thank you very much to the member from Glace Bay. You know, so we need to have two separate clinics, and I think they need to be staffed in different ways to make those ER changes. So I know in Yarmouth there's a couple of proposals that are coming to us that would reinvigorate that, you know, going back to that basics of providing a primary clinic of some kind to see the 70% of people that are sitting there and waiting for 10 or 12 hours. So again, I know that's a longer answer probably than the member really wanted me to do, but my two focuses will be orthopedics, as I mentioned, and ERs. Thank you.
The honourable member for Glace Bay.
Thank you, Mr. Chair. If I may ask just how much time is remaining?
The honourable member's time will expire at 6:21.
Thank you, Mr. Chair. I did just in closing on that subject, because I know another one of my colleagues would like to ask you a few questions. On the subject of wait times, and on the subject, and the minister was talking about ERs and so on. Unfortunately, in this province, and it's one of the problems that we face in wait times, is that sometimes we're just on the edge of peril, you know, in healthcare, because all it takes, my community is a perfect example, is one doctor to pull up roots and leave, and you've got a crisis on your hand of thousands of people who are left without a doctor. Those are thousands of people who are probably not going to find another doctor, and thousands of people who are going to work their way into the emergency departments in my area anyway, because there are no community clinics that are available to go at various hours. So it's you know, you have that instance, and it can apply to a major piece of equipment breaking down as well. If that happens, then you've got problems with wait times and so on. So I understand the minister's. I don't like to call it a predicament, but I can understand why the minister might have some stressful moments in his career, as other ministers have had in the past. I'd like now to share my time, Mr. Chair, the rest of the remaining time with my colleague from Kings West.
Thank you. Chair now recognizes the honourable member for Kings West.
Thank you very much, Mr. Speaker. And an area that the Minister is familiar with, and perhaps all of us here in the House, and I think the member from Antigonish was the Minister of Health when autism was a very, very major topic and concern for Nova Scotians, and was brought to the floor here at the legislature. And through committee work, it has become a line item in the budget. One of the major pieces in that program over the last couple of years that has been rolled out. We all know there's still a tremendous need for the EIBI therapy. If we can intervene with children in the early years, then we know the results are much, much stronger. I'm inside of the mental health budget for this year. I'm wondering, Mr. Minister, is there in fact some increases for that particular program? We know that it's stronger in some areas of the province than others, but budgeted amounts are going to be a critical part for the expansion of that service. Currently, there is a lottery that is used to select children for this critical therapy, which is proving in most cases to make immense improvements, immense gains, help children be much better prepared for school. So I'm wondering, Mr. Minister, is there some additional support for that program in this year's budget inside the mental health allotment?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I can say that this government was very, very happy to be in the front of the autism issue, the issue of getting the correct type of programming for these children. Approximately $4 million goes into this treatment for young children that are not in school yet, that have been diagnosed with autism spectrum disorder, or autistic spectrum disorder. The treatment program is now up and running in 8 DHAs and, of course, at the IWK. Just some stats here. To date, 116 children have completed or are currently involved in the program. There are approximately 75 children eligible for the program. The children are randomly selected alternately between two age groups, up to age 4 and 4 and 5 years old. This ensures that the eligible children have equitable access to this treatment program, as we currently do not have the capacity to see all of the children who would benefit from the program. But what we're seeing is that as the program has evolved over the last 3 years, I believe, or 4 years, that we're getting closer to being able to be seeing all the children. The dollars that are attached to it, and this is overall mental health. So this is not the showing the autism. So the autism program has not been increased. It still maintains its $4 million. The increase in mental health services for the districts in this particular case is up by $10 million or $10.1 million.
Thank you. The honourable member for Kings West.
Thank you, Mr. Minister. And I asked that question because we know that there are many more cases across the province than treatment is able to be provided for, and I got quite an insight to this just as late as Friday in meeting with the superintendent of schools for HRSB, and they have 50 children, 50 identified with on the autism spectrum disorder that will come into their school system this September. So I raised the issue for that reason, and that just really highlights now how extensive the children with on some part of the autism spectrum scale, I guess measuring from 1 to 12 in terms of its severity. One of the issues that has come to my office and in dealing with VASS, the Valley Autism Society group, is again general practitioners who don't have the expertise and the background for the earliest identification. And I know that it's a professional requirement on physicians to do so many professional development modules through the year. I'm wondering if the department has or is looking at any professional development for the physicians in conjunction with Doctors Nova Scotia.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And we haven't necessarily gone down that road, even though I think we might be able to do it now because there are a number of trainers out there that can inform physicians on, what to look for, what to deal with, and those kinds of things. So I think, it's maybe something that we can take under advisement to see if we can roll something like that, some kind of continuing education program for physicians to make them aware of the issues surrounding the program and, of course, children suffering from autism. The other issue that has been becoming more the voice of the advocacy groups really has to do with transitioning youth out of school into appropriate supports and services in the community. So we're I think we've sort of got the right program going on for the younger children, and making them more available, more appropriate for the school system. But we need to work on now, as those children age and get through the system, is to be able to find mechanisms to get them into the community and be citizens that do have something to offer to our communities. So that's where I think the advocacy groups are going. The other issue that I think is very good and is the result of recent changes with the diagnostic process at IWK, that the wait time for diagnosis has decreased considerably. So it's sort of one of those things that as you start going down a road, that you learn a lot more and you can do more good. So to the member opposite, I think there's many more things that we can do, but I think we're on the right track when it comes to this program.
The honourable member from Kings West.
Thank you very much, Mr. Speaker. During the committee meetings of Community Services in November of 2007, all members of the committee supported the concept of a working group. If I just take a couple of the areas talked about here today, when we talk about the need for an expanded EIBI program for speech pathologists, physiotherapist, occupational therapists, and so on, to work with these children even when they're attending school. There are a whole number of issues that are not addressed. We're now hearing more and more about the needs over the life cycle of these children, and needs for those who did not get any help when they were young through intensive behavioral therapy. And so those children are now going through in school or post-school time, and a working group would help to identify even just an actual number of children to adults who do have the autistic spectrum. So working groups in the past are in no way to diminish or to say there are some neglect or deficiencies with the department. I know the kind of work and the leadership that Patricia Murray has brought to Autism Nova Scotia, but by having a working group that spans out across the province, there is indeed real value in what they can bring to Autism Nova Scotia for pointing out areas that still will need considerable work. So I'm wondering at this time, is the minister, doing some reflection on the value and the need for that program in the coming months and years.
Thank you. The Honourable the Minister of Health.
Thank you very much, and to the member from Kings West, I think we continue to reflect on all our programs to make sure that it is, we're getting that patients are getting the best services they possibly can. I think within this one, I think the challenge of a standing committee or a working group is sort of the size of it. I mean, right now, the committee is made up of professionals and psychologists, et cetera, from the districts who work together. Okay. I just want to read through. The working groups include working groups from DCS and DOE. There's a physician group. There's a families group. There's an advisory team and an EIBI implementation management team. So there are already a number of people and groups working on autism disorder in this province. And in my mind, I don't want it to get to be too big and cumbersome. I think they've been reactive and working very well. But as needed, we can pull the expertise of each group together and sort of do the same thing that a broader, larger group would be able to do. So I just don't want to, as we overstudy the issue, which governments tend to overstudy things and overanalyze things when it comes to a disorder like this one. So I want to keep this group as reactive as we possibly can.
Thank you. The honourable member from Kings West has 1 minute left.
Thank you, Mr. Speaker. One last question, and I'll just give the Minister 25, 30 seconds for a comment here, and that is the community health boards are wonderful initiatives, but is it the Department of Health that gives them some of the directions, or are they fairly autonomous to the communities in which they exist?
Thank you. The Honourable the Minister of Health.
Thank you very much, and as the member opposite underlines a very important piece to our system, which is those community health boards. Those community health boards work in concert with the districts, which is where their responsibility lays. We're pretty much hands-off when it comes to what the districts, what those community health boards will be working on, what they won't be working on. So they have pretty free hand there, but of course they still have to do things within reason on the needs and the requirements of their communities and their districts.
Thank you. The chair now recognizes the honourable member for Queens.
Thank you, Mr. Speaker. I want to focus my questions around the need for palliative care strategy in the province. And I recognize that, some good news came out of the Minister of Finance's budget the other day when there was recognition for a palliative care coordinator for the province to look at all aspects of the current system and to help ensure that families do receive compassionate care for their family members who are facing end-of-life end-of-life care. But I'm more concerned about the fact that there really is no provincial strategy that enables all Nova Scotians to effectively have end-of-life care for their loved ones, and certainly the care that's needed for families as they sit with loved ones through those very difficult moments. We certainly do have palliative care initiatives across the province that many groups and organizations have taken upon themselves to deliver that much needed services in communities. Certainly some of the DHAs and hospitals are recognizing and have recognized the need for more access to palliative care. And that's a good thing, and certainly we see some nursing homes that have taken up the challenge of offering palliative care services to members of the community, and of course the VON and home care also work diligently at ensuring those services are in place in the communities. But unfortunately, what has happened is it has become a patchwork of care across this province, and for many Nova Scotians it's become very difficult to accept a patchwork system that may or may not be in place for them for their loved ones as they're struggling with their end-of-life care. Sometimes Nova Scotians are looking at palliative care in a hospital environment, and perhaps their wish has been to have palliative care at home, but unfortunately the palliative care service at home is not available to that particular person in need, and so therefore their wishes, their last wishes, are not being met. And what happens is not only does that place a lot of stress on the person in their last days, but it's also a huge stress load for the families, sitting with loved ones and working through all of the issues that is facing someone in their last days. So my question for the minister is, with this palliative care coordinator looking at all aspects of palliative care across the province, will this coordinator be piecing together the missing components to that strategy? Will that coordinator be working with the DHAs, the VON, the home care folks, the private agencies out there that are delivering much needed palliative care? And most importantly, will the minister be looking at furthering not only the scope of practice for this coordinator, but also putting much needed financial resources into a full provincial palliative care strategy for the province, so that all Nova Scotians are getting the care that they need in their end of days life, and also a comparable care across the province, so that, you know, someone from my community can receive the same care as someone in a neighboring community, and so on. Because I think that's what's important. Nova Scotians looking for the same type of care opportunities and the same sort of access to that care. And as we all know, people who are living out their last days need to have that care, that compassionate care. They need to be facing their last days with dignity. Their families need to also have that comfort and security of knowing that their loved ones are certainly receiving the care that they need. So I'm hoping that the minister is able to tell me first the scope of that coordinator's position in the province, who that person will be working with closely enough, what is their specific mandate, and what funding is going to come either with that position or in behind that position to have a strategy across the province. Thank you.
The Honourable the Minister of Health.
Thank you very much, and thank you to the member from Queens for her interest in palliative care services. You know, palliative care services is one of those issues that brought me to public life, and was very happy to support a move from Southwest on expanding their services. They were one of the areas that had no palliative care services whatsoever, so I was very happy to be part of a government that started to equalize some of the things that were happening in this province. So let me talk about the position first, and then I'll talk about some of those expanded services as well. And simply put, the role of the Provincial Palliative Care Coordinator was initiated in 2007. Sheila Scaravelli is the Acting Director of Acute and Tertiary Care. She's going to be acting as Palliative Care Coordinator role. Now, Sheila has had tremendous contact with palliative care organizations throughout her career. And a matter of fact, at the Nova Scotia Palliative Care Association meeting in Truro, I believe, and look to in here in Halifax, and I know that the member for Truro Bible Hill did attend. That there was definitely a cheer that went up when they were informed that Sheila will be taking that role. So the position is currently in the process of being classified and posted. Well, I think most of that's been done. The position will be supervised by acute and tertiary portfolio. That's been my, you know, if ever I get discouraged as a minister, that's probably one of the issues that has discouraged me the most. When we talk about, you know, different divisions wanting different things of the same people, there was a tremendous challenge on whether this should be a position for acute care or whether this should be a position for long-term care or continuing care. And finally, after months of haranguing, I put my foot down and said, no, acute care will be getting this position because we need to get the person in the position and get it going. Because if we don't get it going, then we continue to be that far behind our process. So the coordinator will develop an integrated model of palliative care including researching and analyzing current issues, the best approaches to serve palliative care clients, and will develop a consistent approach to palliative care across Nova Scotia. You know, too much time has gone by now where, each area has such a different one. I think the original strategy was really, here's the palliative care recommendations that were developed in, I believe, 2002, when that project was initiated, developed that framework for expanding palliative care services in Nova Scotia. But we sort of left it to the district health authorities to set up a provincial program, and the very thing happened that you mentioned was, there's a patchwork of things across the province. I mean, if you go to Pictou, of course, they have a wonderful palliative care unit and palliative care services. The northern region tends to do better than the western or southern regions of Nova Scotia. I had the opportunity just the other day to visit the new hospice at the Cape Breton Regional Hospital. I think it's on the 5th floor of that hospital. Basically a converted wing or converted unit in that facility. Absolutely phenomenal. I mean, you walk in there and it is a very dignified place. It is very quiet, lots of room for families to come in, and basically their mantra, their reason for being is basically to have people in there for short stays, getting them ready, sending them home. And the unit is also a place where the community can call in if they've got a question about the care for their loved one. So it's a fully integrated service with the home palliative care services and that inpatient hospice care. We are expanding palliative care options, which is entitlements, which is mostly to the nursing ones. There's an extra $652,500 that's going into palliative care this year, which would be, I think it's more visits, expanding the home care, so more visits by RNs or VON members, more visits, I think more home oxygen, I believe, and there was another issue I can't remember that continues to expand within that envelope of $652,000.
The honourable member for Queens.
Did you say 652,000? You said 652,000 plus? And that 652,000 then gets divvied up throughout the province to all home care agencies?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and those would be divvied up amongst the patients. Basically, the dollars will go to expanded hours for those individuals at home. So, directly, finally I can say something goes directly to the patient in this case.
The Honourable member for Queens.
So, of course, we never know from day to day who is going to be in need of palliative care services, so that money could kind of be a moving target in terms of, I guess the question is, how did you come up with this particular figure? Is it based on, stats in the previous year of how many individuals are looking at receiving palliative care services? Because again, that's I just would like to know, I guess, how you came up with that dollar figure.
The Honourable Minister of Health.
Basically, to the member opposite, Mr. Chair, is that year over year we have an idea of the population requiring that kind of service, so we can project that pretty accurately. And Mr. Chair, I just want to, and I apologize again for using a BlackBerry, but it seems to be our raison d'etre or our method these days. Palliative care patients can now access about 200 hours of home care services per month for a total of 600 hours in the last 3 months of life. So that's an increase of about 50 hours per month, or over 150 hours over the 3 months. So that's what our calculation is based upon for that population that we project and the added number of hours.
The Honourable member for Queens.
And of course, I'm understanding that to be extended hours over and above whatever services at home they need. Thank you for that answer. If I can just move to another question before I turn the floor over to one of my colleagues. I'm wanting to ask about the use of respite beds in long-term facilities. Again, this is something that a lot of long-term facilities have worked very hard at making sure that they have a respite program in place for the communities to serve the community needs. And of course, we all know that for the prime family caregiver at home with a loved one, 7 days a week, 30, 31 days a month, 365 days a year can be a huge task for a family caregiver. And so respite beds become very important, especially if they're combining respite service with perhaps respite through home care or other services that are delivered in the home. And for a lot of families, just ensuring or knowing that that bed exists so that they can get away for maybe 2 or 3 days, or in some cases a week, just to get the care that they need for themselves. What I'm hearing from some long-term facilities that have been working hard at ensuring that these programs work for communities is that it's a little bit difficult for residents of the community to actually access the beds at any given time. There is a structure, there is a process in place for a person to be able to get into a respite bed, and that becomes very frustrating not only for the family caregiver that is making plans and perhaps only has a certain amount of time that they need that they can work with in order to get the rest that they need in order to deliver better care to their loved ones. And so with that process that they have to go through, sometimes they end up putting their plans on hold because a respite bed may not be available or may indeed not be open for several consecutive days in a row, because sometimes the beds are not open, say Monday to Saturday or 3 weeks consecutively. So if you could kind of explain to me what role your department is playing in terms of assisting long-term care facilities to ensure that the respite bed programs that they have in place will grow stronger and will continue, and also not only continue, but kind of get rid of some of the red tape that families are struggling with.
Honorable the Minister of Health.
Thank you very much, Mr. Chair. And this is one area that we've spent a fair amount of time on the last number of months. We were finding that the current respite beds in the province were being utilized somewhere near, I think, 40% of the time. So we had a 60% of the time these beds were remaining empty. And that could be utilized in either a different fashion or be used by families that need respite care. So we're changing the entitlements. I mean, right now it had to do with entitlements of using up those full 28 days. Or, each patient was available to 28 days in a respite bed per year or something along that line. We're expanding that to 60 days within a year. So we're given basically an open-ended amount of time. So if you need to put your loved one in a long-term care facility for a week, and then they get really sick down the road, there's still plenty of weeks available to them to spend a month if need be. So that was one of the barriers that we were seeing. We are developing a respite in the home program, a true program. I mean, right now through home care, we were trying to provide some time and do it that way, but it wasn't a true respite program. So I think it's more effective in some cases especially for those individuals who are suffering from some kind of dementia, to be able to keep them in their home more appropriately. And also, if the beds are only being used 40% of the time, over the first blush, we should be able to increase that to another number, hopefully 60%, or at least double it to 80%. There's still a number of days left in those beds that we could utilize for adult protection cases. We could utilize it for rapid reaction, some issues that we've been having that we need to be more reactive to. So there's been some tremendous work being done around respite, and I'm hoping to announce that in the next number of months on what we're going to be doing with those, because it's not only good for the patients, but it's better planning for long-term care facilities themselves.
The Honourable Member for Queens.
Thank you, and I'd like to turn my time over to my colleague.
The Honourable Member for Pictou West.
Thank you, Mr. Chairman, and I appreciate the opportunity to ask the Minister and the staff a few questions here.
I had the opportunity on the weekend to attend the Passport to Health fair in New Glasgow. It was well attended. It was very, very good, and lots of great ideas on how to stay healthy in our lifestyles at this time. But the question that kept coming up to me over and over was, what's going on with our ICU? You know, what's going on at the Aberdeen Hospital? And I know my colleague here asked an hour or so ago about some of that, but I just want to return to it for a couple of minutes, and because it's created a lot of anxiety in the community, a lot of stress, and while it's good news, there's progress being made here that come Thursday, I guess the hospital will be again receiving patients in the ICU, but as I said, it's been a real concern in the community, and that was what was being asked of me on Saturday over and over at this health fair. You know, when's our ICU going to be reinstituted? How did it ever happen in the first place? You know, what are we not a regional hospital? Is it not inconceivable that this happened, that we don't have ICU in the greater Pictou County area? So I guess I want to ask the minister, you know, I guess first of all, how did we come to that situation where we had no doctors to cover ICU care? And what was the Department of Health's role? What was the department's responsibility here in ensuring that we had a continuous number of internal specialists on call at all times? And is it entirely left up to the DHA, or is it does the department have a responsibility here? So I'd just like to know how we got to the situation, what was the department's role, and what assistance was given to our local health authority to try to prevent it, and perhaps even more important, to prevent it in the future.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And that's been a constant challenge, and I know the member has brought this to my attention over the last number of months as I've been Minister of Health. And there's sort of two things that have been happening here. You know, there are a number of internists in that area. Matter of fact, one of the highest grossing internists in the province is from that area. And I think there's been a challenge to keep physicians there, or new internists there, because they cannot compete with the existing pool of physicians. Since they are basically billed on a fee-for-service method, there hadn't been a whole lot of sharing going on of that patient pool on their other job of being an internist. Okay, we take from those internists. They provide us with on-call in order to staff the ICU on a 1 in 3 or 1 in 4 basis, or whatever it has been. So by not being able to make a go of being some kind of internist in the area and providing that backfill or that time in the ICU, we've lost them to other areas in the province and to other parts of Canada. So there's two things going on here today. As of course, in my answer to the member from from Pictou East, is they have got a locum program that is going to be working for them in the long term. We will be seeing doctors there utilizing within that program as of May 8th. So that's actually a full week sooner than the district had anticipated. So we'll be getting people in there. And I hope through this new master agreement, the master agreement that has now been shared with doctors will allow more sharing of patient loads and the dollars that are associated with it to allow more collaborative approaches and allow those physicians to participate in the ICU program.
The Honourable Member for Pictou West.
Thank you, Mr. Chair. And you know, I know it's an ongoing challenge, and I guess it was a shock. It was to the community when it was announced a couple of weeks ago that there wasn't going to be enough on-call doctors to cover the ICU unit, and then I guess other hospitals in the area, whether it was Antigonish or Truro or Bridgewater or Halifax, wherever, were being asked to pick up some of the slack. And I know there were 7 patients that were transferred to some of these other hospitals, although they said they too were bursting at the seams, and they may or may not be able to handle patients on any given day, depending on their own circumstances. and not only the ICU, but even the emergency department. You know, there could be backups or difficulties occurring there because, again, these are the heart of the hospital system, and without internists, there's no guarantee the other departments within the hospital can function. I guess my next question then is in relation to the recruitment then of our internists, and what responsibility or what is the department doing to try to attract more internists to the province, and especially at the Dalhousie Medical School. I understand there's only one graduate there this year that is an internist, and there's been some suggestion that we have good quality graduates from our high schools that are going on to study medicine, but then because they have a large student debt off their way to go to Calgary or the U.S. or somewhere that's offering more money. So in the recruitment side, is there any consideration being given to keeping our own high school graduates here and some financial incentive to get them to come back to their home communities?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and you know, to the residents of New Glasgow and all the surrounding Pictou County, you know, we're pretty happy that the District Health Authority has found a solution to their ICU issue. Specifically to ICU closures across the province, just to give you an idea of how we track this, you know, DHA 1 has had no closures. DHA 4, which would be Colchester, I think, right, has been closed for about 375 hours over the last year. There's been no hours closure in District 5 up to today. No closures in District 9, no closures in the IWK. So from the data that we've been able to compile, there's some districts that have not provided us with that information. Total ICU closures have been about 375 hours from April 107 to March 31st, 08. So ICUs have only been closed about 0.3% of the time, and there has been other ICUs and capacity within those ICUs to cover those individuals. More specifically to recruitment and retention, of course, the department provides dollars through the College of Physicians and Surgeons for their CAP program, which of course is the assessment tool that they use to look at international medical graduates. There has been some relative success in getting those individuals through the system and the extra training that they required in order to practice in Nova Scotia. And I forget the total number of doctors we've been able to run through that system. And of course, it's the appreciation for training our own. There has been some negotiations, some discussions going on, and Dalhousie seems relatively happy with proceeding down with our need. We need more internists. There's only been one per year that's been trained. This year there was a tremendous wait list for more internists. So we want to expand that number. The 9 that are being expanded this year, I think there's some appreciation within those 9. Some of those will be new internists. Beyond that, of course, is trying to have a central role in government within our department for recruiting in general, to make sure that all districts have the same types of tools and access to the pool of physicians across the country.
The Honourable Member for Pictou West.
Well, thank you, Mr. Chair. And again, I didn't hear an answer on the high school recruitment issue, but perhaps you can come back to that. I do want to change channels here a little bit and come back again to an issue my colleague raised earlier on long-term care. And certainly for seniors and their families, you know, I can't think of anything that is more stressful on their lives all of a sudden when an elderly parent becomes ill and are faced with the need to go into hospital, and then quite often the need to go to a long-term care facility from there. And all of a sudden, you know, a daughter or a son is being faced with personal care issues in the home, or perhaps sometimes there's just no option, and they end up staying in the hospital. Right now we have 28 residents in the Aberdeen Hospital. I think there's something like 1,400 or more across the whole province, and waiting sort of in limbo between home where they used to live and a nursing home bed that's not yet available. And I realize by the end of 2010 there's to be a number of beds that will be available to long-term care residents. But I want to specifically come back to the Shiretown Nursing Home in Pictou, and certainly while we're glad to see new facilities being built. In actuality, there's no net gain of new beds for beds in the Pictou County area. And actually, some of those beds are going to be moved out of the town of Pictou to other areas of the county. But 89 new beds replacing 89 old beds. And so the question that some people are asking is, well, what's wrong with the beds that are there now? We're in such a dire shortage of long-term care beds. Is it possible to help relieve some of the short-term difficulty that at least some of those beds could still be utilized, if only in the short term, to help alleviate the the overcrowding or the long wait list? If they're good enough in 2008 and 2009 into 2010, could they not be extended in addition to the new beds that are being built to keep them on for a bit longer to help relieve some of that wait time?
The Honourable the Minister of Health.
Yeah, thank you very much, Mr. Chair. And I can say to the member opposite that the methodology that was used to place beds across the province was one that was robust, one that was based on trends, one that was based on population bases. And I think I'm still very comfortable in the allocation of beds around this province. The issue for Pictou County was really based around the number of beds that are available there today, which there are a number of beds available in Pictou County. And there was a lot of areas that had no beds. As I said to the member for Pictou East, there are a number of people sitting in the Shire towns, sitting in the Oddfellows home, sitting in the other facilities in that area that need to go home to Cumberland County, that need to go home to Colchester County, and therefore freeing up beds for the residents of New Glasgow, Pictou, and surrounding areas. And so I'm still very comfortable in saying that our methodology is one that will create an equal footing right across the province. At the same time, the member did refer to a number of people waiting. I think you said waiting in hospital. The number today is about 1,200 individuals waiting for placement in long-term care, which includes community and hospital. And I figure the number is probably, let me see, as of March 5th, 2008. Let me list these ones off. Somebody can add them up for me if you want. 57 people were waiting for placement in Southwest. South Shore. There were 66 people waiting in Southwest, 72 people waiting in Annapolis, 122 people waiting in Colchester East Hants District, therefore why we're concentrating on that area. Cumberland Health Authority was 39, Pictou District was 97, Guysborough Antigonish District Health was 95, Cape Breton, there were 350 people waiting for placement, and Capital District is 445 for a total of 1,343 people. So there's my number as of March 5th, 2008. And I would probably suggest that, I don't know, 10%? No, 10%? No. How many people were waiting in hospital?
There's less than 200.
Yeah, there's less than 200 at this point waiting in hospitals across the province for long-term care.
The Honourable Member for Pictou West.
Thank you, Mr. Chair. Well, the reality is we still have a lot of people waiting in beds as 1,200 or 1,400, whatever, at home or in hospital. It's still too many. I don't think the minister will disagree with me on that. And, even at the end of 2010, when there's going to be a number of new beds, there's still also an aging population that is going to add more people to the wait list. There's going to be more seniors looking for a long-term care bed. I don't know what the projections are at that point in time when those new beds come on stream, but regardless, there will be a number of, a few hundred, I'm sure, of people waiting for a long-term care bed. So in light of that, with a home that's only 35 years old, new beds coming on, but why wouldn't it make sense to keep those beds open also, in addition to what the new beds are there, just to help alleviate some of the increase in the aging population and the numbers that are not going to find a bed at that time?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And I know through the process of the replacement beds at this point, where there are 9 facilities being replaced. There has been some discussion going on what to do with the existing facilities. None of those facilities, in our estimation, can sustain long-term care patients in them as they are constructed. The care is too difficult for the employees working there. The care is too difficult on the day-to-day living for those residents, which is why we moved to replace them. The mechanicals are too old. The cost for replacement of those mechanicals is far too much money for the availability of those buildings. Now, that being said, I think there's a move afoot to look at what else we can do with those facilities. With some renovation, with some, in some cases, major renovation, can we provide another level of care that is needed in those communities? Is there a way to use those buildings for assisted living? Is there ways to use them for some kind of housing method? We don't know at this point, because we've been very focused on making sure that we have the long-term care replacement beds available by 2010. We'll relook at that, I think, once we get closer to those dates.
The honourable member for Pictou West.
Thank you, Mr. Chair. I guess I was just asking, is it possible, considered on a temporary basis, like it's 35 years old now, 2 years from now, 2010 it'll be 37. Could its lifespan be 39? Just as a temporary measure to help out maybe 2 or 3 years to get over the hump. If they've been serving the community for 35 years, can they serve for 2 or 3 more? I guess it's just simply the suggestion. But my time is limited. I've got one final question I want to ask you, and it's in a letter that you replied to my letter. It's about the drug Lucentius, which is an eye drug for those that have macular degeneration, and asking if this drug can be listed under the pharmacare program for seniors. And you've mentioned in your letter that it's going to be listed with restricted criteria, or it's currently going through the process, and it's a possibility that in the near future it'll be listed as a drug that'll be covered under pharmacare. That letter of April the 24th of this year. Can you just give us an update, Mr. Minister, on the status of Lucentius? Do you anticipate that it will be added to the formulary for drug coverage in this province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And I believe, if I remember correctly, the issue is that the drug has been looked at favorably, and the drug will have certain restrictions built in around it so that it's used correctly for the right type of patient. So we should have. I'm waiting basically for those requirements to come to me for final approval. So as soon as the committee does its work, we should have that information available to patients.
The Honourable Member for Pictou West.
Okay, I thank the Minister and his staff for those answers, and I'm now going to share my time with the member from Halifax Atlantic.
The Honourable Member for Halifax Atlantic.
Thank you very much, Mr. Chair, and I welcome the opportunity to ask a couple of quick questions from the Minister. I think these are both things that we have, one is something that we have discussed before, and I just have a question about the listing, the way in which things make their way onto the provincial formulary. I think the Minister will remember we had some dialogue around a constituent of mine who had, suffered from various degenerative diseases and so on, was in need of pain relief, and what had proven very effective for her, she was responsive to morphine but had some difficulties with it, allergic difficulties. She was also responsive to Tremacet. And Tremacet was not covered in the formulary, but what surprised me was, and the reasoning was that it was considered to have a strong addictive potential after more than 5 days use. But what had surprised me was that the World Health Organization and in the United States as well, the FDA, had both listed it as having a lower addictive potential, in fact, than morphine. And I was wondering how it was that Nova Scotia had come up with a different conclusion about this and what it would take to see this argued in its way to the formulary. Because in the meantime, this woman had been told that she was going to have to use a medication which was A, bad for her personally, but B, something which we are dealing with as a systemic problem, from abuse of these drugs.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and I do remember some of the discussion that we were having around it, and I thought maybe it had been resolved at this point, but I guess not. Basically, we work from the Canadian Drug Review, which has the responsibility of overseeing, looking at the studies, studying the drug for listing. We then look at those drugs that have been positively identified by CDR, by our provincial formulary committee. I forget exactly the name of the committee. And basically, they do a test on cost effectiveness and either list or do not list. So, I'm not too sure, where whether CDR has sort of made the decision on whether or not it's more addictive or less addictive than morphine, or whether it was our committee, because it's not really the role of our committee to make that kind of decision.
The Honourable Member for Halifax Atlantic.
Yeah, I had the impression it probably was ultimately a decision made rather on the basis of cost effectiveness than on addictive potential. That's fine.